Hi everyone, happy Wellness Wednesday. Sorry we're a bit late today. Just like menopause, you're late for your period. Haha, I know, I should not go into comedy. Okay, so we're gonna talk about menopause with Dr. Keith Berkowitz, and he's discuss what it is, what to do about it. I'm glad my mom has joined because she can attest to some of the symptoms that she's been going through. So,
Hey,
uh, Keith, tell us all about menopause. Take it away. I mean, besides the fact that it means that women are taking a break from men, they're pausing from men, right? I'm taking a menopause break.
oh my God, when the forgetfulness, well, men get andropause. So,
Yeah.
we talked a few minutes ago, I couldn't figure out what time was what. So I can't be the one to criticize ever. So menopause, again, we've talked about all the stages of a woman's hormones. Menopause is kind of the last stage. It's when the hormones stop. And by definition, that really means that you haven't had your menstrual period in 12 months. Typically, it could be from women from age 40 to age 58. The average is about age 51, my age. So, and I think 3 million women every year enter menopause. So 3 million people out there are now entering menopause and are going through these symptoms that you started describing before.
I also feel like that number is a bit conservative because a lot of women don't all have the textbook menopausal symptoms where they're in between. They should have names for the in between because women with hormones, right? It's kind of like, a woman my age, who is, 48 years old and is perimenopausal, but is still cycling, but still getting some of the menopause symptoms and some of the perimenopause symptom, the combination of both. And the 1 year of not getting your period at all from menopause, you could be going easily into menopause from perimenopause. And
Absolutely, 100%. And but actually, I've seen people that they'll go where they won't have their period for 3 months, have one
yeah,
period, not go for 4 months, have another period, and
yes,
again, there's no exact science. And again, not everyone's running to their doctor and get a blood test or a saliva test to say, hey,
no,
my hormones are menopause. I would say almost the majority of people, it's really from the symptom standpoint that diagnosis is made.
right, right. I wonder why we women don't have that. I wonder if men were going through this, if this would have been resolved in terms of testing, because this is absurd that you can't even test a woman for her hormones. I mean, I know in the UK, in the NHS system, they just won't do it. They'll just give you the drug right away.
Right. And also, I think what happens if we look at blood tests, the range of hormones is so wide and so
Yeah,
extreme. And actually, perimenopause, the range, for example, FSH, we talked about follicular stimulating hormone. Typically in menopause, it's over 30. But in
right.
perimenopause, it can also be over 30. So
Sure.
that's the problem. So it's not necessarily by itself a real definitive diagnosis. And I think that's what really confuses people.
So let's talk about
Actually, it
the,
wasn't I'm sorry to interrupt.
you go
Actually,
on.
it wasn't until recently that they actually came up with a blood test. They said, actually, okay, we're going to use this blood test to diagnose menopause, and we call it AMH, which is anti-Mullerian hormone. I remember using that test it's also often
Fertility.
used test for exactly fertility, for how many eggs are available. So what
Yeah.
happens is, it has to do with the amount of eggs, and AMH goes up usually at ovulation, and then we find in menopause that number really drops dramatically. And that's really the only approved test for menopause that's out there.
That's just insane. And even that's not a very good diagnostic because there's people with elevated AMH in their 30s, so it doesn't make any sense. Or is it elevated or reduced? Sorry, AMH has to be when there's not enough eggs, it goes
Or
up.
reduce. Right.
Yeah, it reduces, sorry, reduces. My apologies. Sorry, AMH reduces when there's not enough eggs. Yeah. Okay. So, all right. So, why don't we discuss some of the symptoms of when people are listening out here? What kind of symptoms do we quite often see with menopause? I mean,
So
everybody knows.
Well,
Everybody's seen Sex in the City and Samantha when she's, at the airport in Dubai and they take away all her hormones from her and she's having like a hot flash. Did you see it, Keith?
I don't. Yeah, I think I did. So that's the first one, hot flash.
You can admit it.
Okay, I've watched it. Okay, you got me. So the hot flash is the most, and what a hot flash is really people start sweating. They're very uncomfortable. The skin becomes very red, and they can last from 1 to 5 minutes. And I've heard stories where people can have 20 an hour, or more than that per day of hot flashes. It's probably the most common symptom people get. And then the reverse of hot flashes, which is the nighttime version, is night sweats. So that's a common one, and that one of the big symptoms that goes with that is actually insomnia, where people can't sleep because of that. So, and then they wake up in the morning, the sheets, the bed are drenched.
Yeah.
From the sweat. So those are the most typical people think of. But some of the more severe ones, we talked about mood disorder, which is a very common one, where really moods where I call emotional layability. It goes up and down. Liability too, maybe. It goes up and down as the day progresses, where people describe to me they're in the middle of conversation and they start crying for no reason.
Right. Yeah.
Absolutely no reason at all. They'll start crying. So
yeah, the hormone fluctuations are increased, and let's talk about what's happening with that. Why is that happening? Your estrogen levels are dropping, your progesterone levels are dropping, your testosterone levels are dropping, and what all do these hormones do, Keith? Right? Estrogen equals memory. Estrogen equals vision. Estrogen does so many things. It works with neurotransmitters. These are hormone messengers. When they drop, it's a massive change in every single area. And so, Keith, maybe you can describe why that happens for a woman, exactly why she is starting to cry for no reason, or
so interesting.
Yeah.
And to take a step back, I want to talk about the two different kinds of menopause, right? So we think of menopause is the more common is where you naturally go through it. But a lot of women today, either from surgery or medications, will go through we call an immediate or surgical or chemical
stress.
Menopause.
Or
right.
stress.
Or stress. And that's a very severe version where all of a sudden it's like cutting off the hormones at that moment, and the symptoms become much more severe. So what happens is, again, we think about the body being, I love that term, use the word concert, right? Everything works together.
Yeah.
So the hormones is a big part of that. That's a big part of the way neurotransmitters function, the way cortisol functions, controlling your blood sugar. And when that is off, that can actually cause a lot of instability. Typically, we talked about before in premenstrual syndrome where serotonin drops, you see that same kind of syndrome in menopause where the neurotransmitter levels do fall. And that creates more of that emotional issue. And the demand becomes greater for that as well.
I like to give the analogy as somebody cuts off the electrical supply to your house, and now you have to use candles to read everything and to do everything. That's what happens in menopause, is that your ability to send messages, this hormones to send messages, are diminished because there is no, you're working at a level where, it's harder to see, it's harder to do anything without electricity. So that's how it feels. The lights get dimmed, your mood gets dimmed, you feel, lethargic, tired, fatigue, joint ache, hot flashes. It's a real hot mess. And, for women that are reaching those ages, I have some women that were athletes and went into menopause early. There's also a genetic propensity towards when your mother went into menopause. That's more likely to when you might go into it. And then if you add things like poor diet, stress, all of those things, you can go into menopause earlier.
Actually, they did a study on smoking. So people that smoke actually go into menopause an average of 2 years earlier than everyone else. So I would assume bad diet, all those as well too, will have that same effect as well.
Yeah, absolutely, 100%. So that's a good reason to be optimally healthy. The other thing is vaginal dryness, right? That's like it's something I have for complaints in women even in their 30s. And if it's starting in your 30s, you're likely to have it worse when you're going through menopause in your 50s. So it's something to do with the estrogen to progesterone ratio, and also how you're metabolizing those hormones. Can we talk a little bit more about, somebody has these hormones. But what happens when these hormones turn dirty and they
I love that term.
metabolize?
Oh, dirty hormones. So what happens is, again, you're getting the hormones not in the proper ratio. I mean, we've talked before, example, about progesterone, for example, when you get stressed. Well, guess what menopause is? It's a stressful situation. So even when we mentioned before that although the ovaries are the majority of the source of these hormones, the adrenal glands also make them as well. And some of that production still lasts after menopause. So what happens is, again, your body gets stressed, whatever progesterone is left is gone. So that causes even more issues. And typically women feel that the most: difficulty sleeping, night sweats are the two big ones with low progesterone. Then you have estrogen. Well, estrogen's interesting. So as people gain weight, and that also happens in menopause, the type of estrogen also changes. Estrogen's a good thing when it's working on your hormones. It's not a good thing when it's helping with body fat production. So you see that change. And again, typically you see estrone, which is one of the, I'll take a step back, the three types of estrogen. Remember, it's estradiol, estriol, and estrone. Estradiol is the most common one during most of our years, most women's years of fertility. Estriol is when you're pregnant, but then estrone comes out after menopause. And a lot of people think that as estrone rises, that becomes even a risk factor for things like breast cancer and other illnesses as well.
Absolutely. And again, it's that symphony of hormone balancing effect that we need. And these hormones can turn dirty. And when they turn dirty, they send the wrong messages. And
on that same note, one thing I also learned, and I didn't know this actually, so testosterone falls after menopause, but actually later it goes back up.
Right.
So, and again, and I finally put together, this is why people actually start getting belly fat, right? Women start getting that belly fat as they get older, and that's also related to some of that excess testosterone.
Also, this is why women tend to get adult acne in their 50s, and they're like, wait a second, I'm not even a teenager anymore, and I'm suffering with teenage acne. So a lot of women that are in their 50s will start to get acne, and they'll be like, what is going on? Like, I'm not a teenager anymore. And again, it's that testosterone. And remember, ladies, your cortisol levels, your adrenal glands support up to 30% of hormone production. So even if you've had a hysterectomy or you're going through menopause, you still have hormone production from those adrenal glands. So what does that mean? That means you have to support and treat your adrenal glands like fragile eggs. You really have to pamper them like princesses. Each gland, you have to really take care of them, because that's all you have, really. And, you still have some, hormones coming from your ovaries, but I mean, how much of it, Keith, is actually coming?
Probably pretty minimal, and as time goes on, less and less. I mean, again, as it's a vicious cycle, because more stress, less hormone. You're going around in the cycle. So that's what makes it more challenging, because again, you're stressed by the symptoms of menopause, but that stress ends up making menopause worse. So that goes around.
I'm glad you brought that up, because for those women listening, what happens is that they feel so crappy that they start eating sugar or drinking more wine, because that's the only thing that those are their coping mechanisms, right? So they'll go for the wine, and then they'll get rid of the wine and say, okay, this is not good for me. And then they'll go for the sugar because they've stopped the wine, because their body's needing some kind of stimulation, some dopamine, some kind of blood sugar, because they feel so crappy. But if you just stick with supporting the adrenal glands and also the thyroid and blood sugar, those three things, I want to go into treatment now, Keith. Like, what can we do about this? I know naturopathic doctors, you and I work very similar, but I'm going to let you do the talking on the treatment protocol of how you and I treat this.
So first, I want to bring up your point about thyroid. So important, because thyroid disease mimics so many of the symptoms of menopause. Yes. So one of the first things is people, especially if they start getting menopausal symptoms early in their 30s or 40s, really have to make sure they get a proper thyroid workup to make sure that it's not thyroid disease. Very important, because a lot of the symptoms are the same.
Hashimoto's is on the rise. I'm seeing a very high rate of patients diagnosed with Hashimoto's, thyroiditis, and just Hashimoto's. I mean, it is autoimmune markers, really, really, really important. And guess what? You can get rid of those autoimmune markers through diet, lifestyle, and supplements.
So it's interesting. So we talk about treatment, and the treatment really differs on depending what you look at. So from the mood, we talked before about mood, for example. Certain things like B6 work, things like tryptophan or 5-HTP you mentioned last time often help by increasing serotonin levels and can help with sleep as well. Things that also actually manage cortisol better. I use things like theanine, which is an amino acid, to do that, or lemon balm, which is another important one, or GABA. GABA is one of the other neurotransmitters that help the body relax. So not only help you relax from the stress of the pandemic, but also relax from the stress and the mood changes that go along with menopause. Very important.
Yeah.
One of the next ones is urinary incontinence is very common. And that really, I think, a lot of times goes along with vaginal dryness. So what people don't realize is that actually women who have vaginal dryness are much more likely to get urinary tract infections and develop more urinary incontinence. The more lubrication is not there, the more problematic that becomes. And, you know, we'll talk about hormones, but sometimes actually for vaginal dryness, they'll use actually localized estrogen. One of the common ones people use is Vagifem, which is estradiol, and localized to that area to help with lubricate. Some people use vaginal moisturizers or lubricants, you know, typical ones. I've seen vitamin E, for example, used. Hyaluronic acid used as well, too, for that part. Also, what also helps with vaginal dryness, and this is the conundrum, is actually healthy sexual activity. So sex could be very painful with vaginal dryness, but actually regular sexual activity does help with lubrication. It does stimulate that hormone production to have more lubrication there as well. So that's a catch-22 for some people.
Yeah, and just to explain to everybody that's listening is what's actually happening is when your estrogen levels decline, you get something called atrophy, okay? And that atrophy of the bladder lining. And so that causes irritability of the bladder, and then that causes you to need to go to the toilet several times a day, and even some incontinence. And so we even see women in their 40s waking up in the middle of the night 2 to 3 times at night to go to the bathroom. And, you know, these are the individuals that are likely, you know, if they are sexually active, likely to get urinary tract infections. So it's something that's super, super important to, you know, there are herbs that we can use in addition if you're starting in your 40s. The whole thing with menopause is if you're already there, don't worry about it. You can still do something about it. But if you're getting into the perimenopause, you need to get with the program now, because whatever you do now will help you when you go into menopause.
Oh, so true. Absolutely. And again, no matter where you start, you can make a difference. And talking about vaginal atrophy, I've seen in practice where it's become so bad that even when practitioners try to do a manual exam, they can't, because the area won't dilate enough because of and that's really important, because again, you want to prevent that from happening. And again, that's a lubrication or localized hormone is probably the best things for that.
Vitamin E works like a charm. And I love that you brought up hyaluronic acid. I should create like a vaginal rejuvenation supplement for the vagina. I'm going to have to look at that. Yeah, because it makes a nice mixture of vitamin E, vitamin A, also with hyaluronic acid. These are great combinations for vaginal atrophy and even keeping, you know, the lining healthy.
I mean, you talk so much about collagen, which is your expertise. I think that becomes important if you want to tell people how that works in that area. That's really
so collagen. So not all collagen is created equal. I use marine collagen, and guess what, guys? I'm formulating a new product that will be out, I hope, in December. So Keith is a combination of marine collagen. It's the collagen that was studied in the south of France to help with fine lines and wrinkles. But also it's not just fine lines and wrinkles, it's muscle aches, joints. We can talk about, you know, the benefits of collagen in that area as well. But it also has branched chain amino acids. As you know, as we go into menopause, the amino acid absorption from protein is lower. Electrolytes, which we are all dehydrated. I love Keith because he really understands dehydration so well and the significance of it. It also has CoQ10, amla, and lucuma. And so it has a bunch of antioxidants in it. So it's going to be an amazing product for, I've been taking it every day, and I notice just on my skin itself, just like not having to put moisturizer on. So it's sort of like moisturizing from within, if that makes any sense. And also like less joint
And
pain.
we didn't, and actually, if you think about some of the symptoms of menopause, joint pain, joint aches, dry
Yeah.
skin becomes, and again, the aging of skin also becomes more, you know, and one of the things people see is I call it the paper skin, right? As women age, typically the skin
Yeah.
becomes paper, where if they just rub their skin against anything, the skin breaks and cracks.
Right.
And actually, that's why that collagen aspect is so critical, especially as we get older. Very critical.
100%. 100%. We'll do like another IG live on the collagen when it comes out. Okay, so let's talk about treatment. What can we do? I want to just start off by saying the first one that you're going to talk about, I think, is we're going to talk about botanicals. So we start off with black cohosh. We talked about this last week and how in Germany, their primary treatment for menopause is a product called Remifemin, which is a standardized Simisafuga rhismosa, which is a standardized extract of black cohosh, and it worked extremely well. I used it clinically when I started naturopathic as a naturopathic doctor, and I don't know why I got away from using Remifemin, but I think a lot of companies since then have standardized the extract. Because
when I started practicing, that was the main treatment that people used.
It was.
I remember
Yeah.
in the early 2000s by far.
Yes.
And what I've learned about black cohosh recently, which I didn't know before, is it doesn't have an estrogen-like effect. So they've actually relooked at it, and it doesn't stimulate hormone-sensitive tissue. So that's really even more important with people with risk factors and family history, where hormone sensitivity and changes are really, you have to be careful of. You know, people with
I
family
love
history
that
cancer.
you mentioned that. I love that you mentioned that because a lot of people are freaked out about going on botanicals and hormones. And I believe, Keith, the way we describe it is that black cohosh is actually estrogen-like, but it pretends to be estrogen, but it doesn't stimulate the estrogen response that estrogen does. So it occupies the receptor site, thereby reducing your risk factor. So there's actually an increased safety when you're taking black cohosh.
Yeah, so I learned that. I didn't know that before because we were always taught that it had an estrogen effect, but it's actually, turns out it doesn't, which is great. And then there's things like red clover people use, Don Quai, which talked about last time. Ginseng is another one. And in more severe symptoms, I want to talk about some of the other things I like to use. I'll use things like milk thistle.
Yes.
And calcium deglutinate is another one that I'll use. And things like DIM we talk about, or indole 3-carbinol. And that's actually a little different approach than we've talked about before. A lot of times people talk about the approach of giving hormones. Well, there's also another approach in getting rid of what your body shouldn't have, right?
The dirty hormones, right?
Exactly, what you mentioned before. So this is a way where milk thistle or calcium deglutinate and DIM or indole 3-carbinol work by actually helping the liver get rid of what shouldn't be there and getting rid of those excess amounts of hormones that we see now more than ever before.
So I run a lot of stool tests, and I know so do you. I know that's what I'm going to be known as.
Well, if you go back to ancient medicine, that's what ancient medicine was about. It was about checking the stool and checking the urine. That's all you had.
Apparently, in my last lives, I've always been a doctor, a medicine woman doctor. So maybe that's what I was doing, is doing stool analysis. But going back to what you said with milk thistle, calcium deglucarate, and DIM, what they do is they detoxify and clean out the dirty hormones. And there's, in a stool test, I quite often see patients with elevated beta-glucuronidase, right? So that's an enzyme that means that you're recycling dirty hormones back into the gut. When I see that marker elevated, and I do quite often see that marker elevated on, guess what group of people? Menopause, postmenopause and menopausal women, and sometimes in perimenopause. If it's in perimenopause, it means that they're reaching menopause sooner. So these kind of things can give us clues as doctors to like jump on that right away. But isn't it okay for people to just go ahead and take these products, you know, if they are on hormone replacement therapy or if they're on botanicals, Keith?
You want to be careful and watch, and you want to, and I think we're going back to the thing about measuring. And a great example is we talked before about how testosterone can often rise as women age. So if you're giving
Right.
something, you may actually upset that balance and not realize what you're doing. So what you want to see is where the imbalance is. And again, more typically today, we talk all the time, especially as people gain weight, they have excess levels of estrogen. And that tends to be the one that tends to become toxic and builds up more than any of the others.
And then causes insulin resistance and all that fun stuff.
Exactly. And that's where it was called the fanny pack, right? People, as they get older, would develop a fanny pack.
Oh my God. People in the UK listening to that are going to have a hoot. Fanny pack means something else over there. Anyway.
Okay.
Okay. So then we're detoxifying these dirty hormones, right? And I have a question for you because I'm colleague to colleague. I'm hearing mixed results, and I've never seen this clinically, but people who are low already in estrogen, there are some practitioners that say don't give DIM because it completely diminishes your estrogen levels. I don't really know if I've seen that clinically, and I just wanted your feedback. And we also have a question here too. All right.
Oh, and I want to know what fanny pack is different in Australia too. So
Oh, let us know, Michelle. Let us know. Don't hold back. This is all about talking about vaginas
and the answer
and
is
menopause.
the answer is yes, and it depends on the person. So
Yeah.
the answer is both ways. And I've seen it in actually even women who are getting their menstrual period when we use it for sometimes PMS symptoms or people that are having things like polycystic ovarian syndrome, that it can also decrease estrogen. I think what people don't realize is estrogen receptors are different in different parts of the body. So something could be enhancing one receptor in some part of the body, but actually blocking another. And that's what we have to be careful of looking for. Okay.
So, I think we need to be careful of that. I haven't had any issues. I use a combination of milk thistle, calcium D-glucarate, and DIM. And those are like my 3 favorite go-tos. And they work extremely, extremely well. So there's your answer.
And there was a question on that. If I can answer the question as we're talking. Yeah. So they're saying if you're taking HRT, can you not take a course of milk thistle? It doesn't mean you can't take it, but you want to see what the levels and see if that is having a negative effect, which you can in some people.
So wait. The milk, I'm talking about the DIM with DIM.
Oh, I'm sorry. But
not
someone
milk
asked
thistle.
about
milk thistle is totally fine. Milk thistle is fine. It's DIM that you have to be a bit wary about. So Keith, there's your answer, what fanny pack is, in case you want to know.
Okay, I got to be careful what I say next time. I learned something new today.
We're talking about vaginas and menopause today. I mean,
okay, so I get away with it then.
You can get away with it. You can get away with anything, Keith. Your heart's in the right place.
But thank you for the new knowledge. I really appreciate that. So now I know when I go to Australia.
Okay, so then we talk about Kava. I love Kava because Kava is really good Kava got a really bad reputation. I believe it must have been, I don't know, 5 years ago. It had all this research on it being toxic and bad for you. And a lot of people stopped using it, but it works extremely well in like the anxiety aspect of menopause, which a lot of women tend to get.
And I think the thing is to be careful is you want to watch your liver function, right?
Yes,
so people that I think who have liver dysfunction to begin with probably shouldn't be using it. And that's where the key is at the end of the day.
Like if you have a fatty liver or non-alcoholic related fatty liver, then, maybe stay away from it. But I think you would have to take a load of it, Keith, for anything to happen.
And actually going back to fatty liver, I think that's important. That's where milk thistle can play a great role. And actually, when you have a fatty liver, detoxifying your hormones is so much more challenging. And I think that's a great point. So people with fatty liver or fatty infiltration of the liver, and they call it sometimes stidiosis, is actually because of that fatty liver causing more hormone imbalances as well. Yeah.
Remember, your liver detoxifies everything. It's like, that's like, when you get one of those water jugs, it's called a HEPA filter, because that's what your liver does, is it detoxifies. It basically is like, you go into it and it's like a washing machine, and it puts you into different categories and detoxifies you based on, are you fat-based, are you water-soluble, are you a different kind of drug? And depending on how healthy your liver is going to depend on how quickly we get rid of those dirty hormones. So milk thistle is key at helping you detoxify your dirty hormones. And also those women in menopause, I just want to add one thing before we go on to the treatment. If you are constipated and you are menopausal and you are an HRT, that is extremely dangerous, because that means you're not eliminating those synthetic hormones out of your body, and you're reabsorbing them, and you're creating an absolute symphony of disaster. It's like 20 instruments playing at the wrong tune, and it sounds terrible, and it feels terrible, and it will look terrible. So remember that you need to go number 2. Here I go talking about shit again. And milk thistle is really, really helpful with that. So anyways, what is the best effective way to rid estrogen besides sweating through exercise and eating lots of veggies to detox the liver? Good question. Do you want to answer?
Sure. So milk thistle, again, is one of those
Yes.
aspects that helps. Also controlling your blood sugar. You know, that is really critical, because when blood sugar is off, you have more of an imbalance where you'll have more estrogen, testosterone, and less progesterone. And that creates an issue too. And actually, the more insulin you have, and that's when your blood sugar is high, the more likely you're going to actually form more estrogen, because you're developing more body fat.
The other thing I would say for estrogen, definitely sweating and exercising, eating a lot of veggies, you know, a lot of broccoli, cauliflower, cruciferous family type vegetables, really good at getting rid of those dirty hormones because they've got DIM in them.
And remember, roast them is the best.
Yes.
At low temperature.
Right, because otherwise it's really hard to digest. The other thing I want to add, which a lot of people don't know about, is probiotics. Probiotics are super important in getting rid of dirty hormones, because what they do is they balance the microbiome in the gut, and they help you go to the bathroom regularly, so you're eliminating. It supports the liver, it supports the digestion. So menopausal women, I always get on probiotics.
And that's such a key point, because remember, our sex hormones are fat soluble. So those are the most difficult molecules within the body to move out and to get rid of. So that's why probiotics are so important, to create that, I call it, non-inflammatory area, to help, you know, everything leave properly in the proper way. Through number 2.
Number 2. If you're not going number 2, you're not getting rid of those dirty hormones. So, and remember, those dirty hormones are going to recycle and cause havoc. It's going to be like a symphony of disaster with all the instruments playing in the wrong tune. Okay, we move on to evening primrose oil. I love evening primrose oil, Keith. Just putting my feet up here. I love this conversation. Tell me about evening. What's your take on evening primrose oil? I mean, naturopathic medicine, we've used this for years and years. Well, what's your take on it?
Again, we use it a lot for hot flashes, so it's really critical for that aspect. Being probably, I would call that probably the main menopausal symptom people get. Or actually, I would say it a different way. When people realize they're going through menopause, it's usually because of hot flashes. Mm-hmm. Hot flashes are really, right, the first symptom that people say, okay, I am now going through menopause, or in some cases, perimenopause. So even primrose oil is one way to actually help balance out that, so the hormones, so you don't get as many hot flashes.
Yeah. Also, mood disturbances are some of the preliminary findings as well.
Yes, thank you.
You should know that better than anyone, Keith. Okay, so really, really good. The evening primrose oil is great. Anything around so perimenopause and menopause, and a woman that's going through menopause right now, what kind of dosages are you looking at for evening primrose oil?
I would say probably I'd start off in at 500 milligrams and sometimes increase up to 1,000 to 2,000, depending on the symptoms. Is that what you use?
Yeah, it's exactly what I use. We're like twins, Keith.
No, I listen to you. That's what it is.
Oh, come on. Whatever. You are brilliant. I love working with.
And the last one we could talk about is, again, HRT, right? So that's the big one.
Okay, yes.
So we talked a lot about last week about.
Why don't you tell everybody what HRT means, just in case they don't know.
HRT is hormone replacement therapy, right? So your 3 main hormones you look at, obviously estrogen, progesterone, and testosterone. And estrogen really in the form of estradiol. Actually, years ago, I don't remember if you did it, we used to use all 3. Typically, we would But now it's much harder to do, and more typically they only use estradiol form of estrogen and sometimes estriol as well. So what happens is you want to try and use that, as we talked about before, in sync in what your menstrual cycle used to be. And for most people, that's a combination of estradiol plus progesterone. And using estradiol, again, has your periods. People often take it for 25 up to 28 days of the month. I've seen more. Have you seen this more and more people doing where they take a 3 or 4 day break of estrogen?
Yes. I think it's a good idea. I think it depends on the person. I think it depends on how, how regular they are with their bowel movements, how sensitive they are, because sometimes for really sensitive patients, I like to take a bit of a break. It depends. Everybody has a different half-life of what they, if you and I took the same drug right now, we talked about this last week, we would metabolize it differently. So I think it's just about assessing individual.
Yeah. But I think that's become more and more popular, where they look at a 28-day cycle and they would give estrogen replacement probably in 25 of those 28 days. So then from the other aspect becomes progesterone, right? So remember, progesterone we typically see in our menstrual cycle after ovulation. So that would often be given from day 14 to day 28. So actually you may get some of that carryover. So you have some days without estrogen and getting progesterone from that aspect. The one that's most controversial is testosterone. So about whether to use it or not to use it.
Right.
And when you do use it, that actually is one you can give every day, that you don't have to, people give through 28 days cycle. And I think the caution we talked about is typically when women have very low levels, they'll start early when they're younger, but as they age through and menopause is further away, you start to make your own testosterone a little higher, that often we will taper down that testosterone. I had a case this week, actually, of a woman who's been on the same hormone replacement dose for 30 years. She's now 78, and all of a sudden her testosterone went through the roof. And this is why.
It converted,
so, And again, so converted. So really, literally up to we did a blood draw in 6 months ago, it was normal. So within 6 months, all of a sudden it started rising. So now we have to slowly taper off the testosterone because of that. And as we talked about before, as we age, your body makes its own. And by the way, she is insulin resistant, so that is probably triggering that as well.
So Keith, I want to add so there's also bioidentical hormone replacement therapy. A lot of people, I prefer that form of hormone replacement. But I want to add in DHEA, because DHEA is extremely important in women in menopause and postmenopause, because these levels completely decline. And instead of giving testosterone, I quite often like to use DHEA, but you still have to make sure you look at your hormones, because DHEA can convert into estrogen and some of these other hormones. Can we talk a little bit about DHEA?
Sure. DHEA is so interesting. It's almost called the aging hormone in a way, right? So
anti-aging hormone.
Right.
Oh yeah, the aging hormone. Yeah.
Well, you want it to be an anti-aging hormone.
Right.
So as we age, that definitely declines. It's really interesting. It actually doesn't really have much purpose on its own, but it actually is your precursor to most of your estrogen and testosterone production in your body.
Right.
And so that's why, and as we age, that declines. So we often will replace with that. The one caveat you have to be careful is you want to see if someone's estrogen or testosterone dominant. It will take the path, what they call the path of least resistance. Mm-hmm. So it may actually increase that in someone who already has that underlying issue. And that's why we talked before that I always, before prescribing any bioidentical hormone therapy, which is my pretty much 100% what I use, as I will check hormone levels to make sure we know once we start the therapy within 3 to 6 months what the hormones will be coming, especially if you're using something like DHEA in that mix.
So in respects to bioidentical hormones, just maybe explain to people that are listening, what does bioidentical hormone replacement therapy mean?
So really means is you're actually trying to mimic what your own body has produced on its own. So that's really what the key is. And again, last time we talked a little about, it can be in the form of a cream. It could be form in a pill. Gels as well. I've seen sprays, different forms it can take, but you try and as best as possible replicate what your body was doing before. And again, if you think about, that's what makes the most sense, right? You want to match what physiologically your body's used to seeing. And I think we've gotten into trouble over the years by not doing that. A lot of the previous studies on hormone therapy where we've seen negative outcomes often was when we weren't physiologically managing our hormones properly.
Okay. I think that sounds, what else are we looking at here?
And we talked about that progesterone was horse urine last time,
Yes.
which is the synthetic progesterone, which isn't even progesterone, but the synthetic replacement for progesterone.
Right. All right. So now what can we do to recommend for mold in somebody's system? You know, mold is a very interesting one. It can really mess up hormones. We don't unfortunately have enough time to discuss this, but what I found works really, really well with somebody with mold is sauna, infrared sauna is really interesting for treating, and inhalation using thyme has been really, really helpful for people with mold. There's also some really great chelating products and also some biotoxic products that you can use to absorb the mold, but it's important to find out where the mold is coming from. I think we have time for one more question. I've been treated with testosterone to build bone for osteoporosis. What are your thoughts on this?
I've never used that, but I guess if estrogen has an effect on bone, I would assume that testosterone probably does as well. Again, typically with hormones is usually they work the best for osteoporosis if it's really given as soon after menopause happens, so as soon as possible. That as time passes, if you pass 5 to 10 years, a lot of that bone enhancing effect of hormones really you start to lose. That's really critical. But I want to look at that. I've never used this. Have you for bone building? I've never.
Well, testosterone on its own, I don't use for bone building. You know, we know that vitamin D and K1 and K2 are really important, but there is some correlation between low testosterone and low bone density, for sure.
Very interesting. So that's.
Yeah, well, because we know the testosterone and muscle mass, you know, there is a correlation there. So definitely some indirect relation with testosterone and bone for osteoporosis. All right. It was always a pleasure, as usual, Keith, with you. And I am excited.
I think you need to mention your book. There's another question there.
Oh, yes. We both actually have books. Keith, why don't you tell them about your book really quick?
So, Owen, thank you for that comment about the testosterone raising. That's really great information.
That's
so
cool.
I learned two things from Michelle today. Thank you. One very important that I have to be careful of, and one medically important. Thank you.
Michelle, you were a great addition to our chat today.
And so my book is called The Stubborn Fat Fix. It's by Rodell. And I have actually a cookbook as well, The Complete Idiot's Guide to Flour-Free Eating. So those two books are out.
And I've got a book out called Younger Skin Starts in the Gut and also Reverse the Signs of Aging. There are two, one's in the UK and one's in the US. Thank you guys for joining. We always love doing these. Please let us know how you're liking the lives. And if you want us to talk about something, we're going to have a think about what we'll talk about next week. But give us, DM us some ideas and we will talk about them next week. Thanks for joining. We love you guys.
Thank you so much. Have a great day.
Bye.